What exactly is the epidural? Some of the pros and cons of the epidural. What's the postpartum recovery like? Okay, so here's everything you need to know about the epidural before you get an epidural. This is a very casual setting because I'm currently pregnant, and basically every 2 hours I feel like I haven't eaten in like 5 days. So I always need to have my snacks around me. But first of all, what exactly is the epidural? I'll explain it casually. It's basically a very tiny tube that's inserted into your spine that delivers medicine into your spine to help numb the lower half of your body. And typically it's used during labor to help mamas cope with the pain that comes with the contractions and everything that comes with labor. So it numbs you. You can still talk, you can still feel the top part of your body, but your lower half, the sensations are not as strong as they once were. Now, let's talk about the timing. When can you get the epidural? Most moms get the epidural when they're in active labor, but you can pretty much get the epidural anytime up until, let's say, the baby's head is like literally trying to come out. So you can delay it, or you can get it earlier. It's typically up to you when you feel like you need that extra support. I've had a client who got the epidural. She was fully dilated at this point. She'd been pushing for several hours actually, and then she was tired. Things were not just coming. The baby wasn't coming out, and she was able to get the epidural at this point. So really, up until when like baby's literally like coming out, and also if you can sit still, you need to be able to sit still. If you can sit still and the head is not literally coming out, you can most likely get your epidural at any point between then. And then I know a lot of moms talk about like how effective is it, like what do I feel? It really varies from person to person, just depending on your body and also depending on how much of the medicine you get, because you can sort of control it. They would give you something like a little button that you can push to ask for more of the medicine to go into you. Now you can't overdose on it. They've put things in place that it would not give you more than is safe, but you can control it. So depending on how much you've taken, some people take a very light dose that sort of they still feel things, they can still move and walk around, while others, they don't want to feel anything at all. But for some people it doesn't even work. Just depending on your body and how your body reacts to things, it might just be like nothing is happening. This also depends on if they put the epidural in right for you. So it really varies as to how effective it's going to be. And sometimes I've witnessed some clients, they get it works for 2 hours, and then it starts to like fade away, or it starts to get touchy where they can feel pain in one point and they can't feel pain on the other point. So really you just kind of have to see how your body reacts to it. You might also be wondering what the procedure is like. Now, don't worry too much about this, because usually when the anesthesiologist comes in to give you the epidural, they're usually pretty good at telling you, okay, so this is what you can expect and all of that. But here's what typically would happen. They'll wheel in the epidural cart that has all the things they need. The anesthesiologist will come in, talk to you about what to expect. They'll give you a hairnet to put on your head. They'll give you and everybody around some masks to wear. This is just to make sure that things are very sanitary. And then typically they would numb the area where they would be putting in the needle. So they would first of all use a natural needle before they put thread in the tube, like a rubber, very tiny tube. So they would numb that area for you so it doesn't feel so painful. They would disinfect the area. Then they use the tube, and I don't know too much details about how it goes, but basically the goal is that they end up threading that, it's called a catheter. It's a very small tube. They would put that into you. Also, they do something where they give you first like a test shot, where just to see how you're reacting to it before they then give you the continuous dose. And again, it's connected to those lines, those poles, like where they would hang the bag, and you get the button where you can push on it. This is sort of roughly what you can expect. And then you typically hold onto a pillow and crunch over, and then you have to try your very best to stay still, which is why it's some moms are not able to get it just because they're in so much pain that they can't even sit still. But then you have to sit still and sort of curve your back, and then the anesthesiologist will take it from there. It doesn't take too long. I don't think I've experienced moms act like it was very painful. A lot of it is just, your mind, you're worried, you're not sure how it's going to go. But if you're able to stay calm and you have somebody who's really good at doing what they're doing, then it should go pretty smoothly when they're putting the epidural into you. So I want to tell you about what you can expect once you get that epidural. So basically, when they give you that first dose, they give it some time before they start the line of continuous dose. And for the first hour, when you get the epidural, you have to lay down flat, just so that everything can sort of balance itself out, because it works with gravity. If you're standing up, it would go all to your legs, which is not where you want it. You really want it around your belly, right? So they would make you lie down flat just to make sure they have an even coverage of it. After some time, they will also do some checks with ice, a bag of ice, just to see if it's really numbing the areas that it's supposed to numb, and to make sure that it's not going too far up and like numbing you to your neck. So they will do those checks. After you've been on your back for that 1 hour just laying down, you will typically then be able to move. But the thing you need to know is that when you get the epidural, you become hooked to that pole that I was telling you about. They also have to put you on IV. I forgot to mention that earlier. They give you fluids to help make sure that your blood pressure stays the way it's supposed to be. So you're hooked to those two things when you get the epidural. You're also hooked to the continuous fetal monitoring system. So typically you have the option to either have continuous fetal monitoring or intermittent. The continuous one is when I'm sure you've seen it, where they put those bands on the mom's belly, and then you're hooked up to the machine where they're checking baby's heart rate continuously to make sure that your baby's doing well. But then there's also the intermittent one, where every 15 minutes you would come back to the bed and then they would check you. If you get the epidural, you wouldn't have the option to do the intermittent fetal monitoring. They need to keep a close eye on your baby to make sure your baby is doing well. So all these things, they do two things. They make you strapped to the bed where you can't move, you can't go far out from the bed. And then it also makes it so that you are not very much as independent. Like, you have to follow the things that the doctors and nurses are saying when they're like, okay, you need to lie down now. They are sort of in charge because you've introduced an intervention, and so they have to make sure that the intervention is going according to plan. What else? Another thing you need to know too is that the epidural relies a lot on gravity. So sometimes, even if you're standing maybe just by the bed and trying to lean over and just to take an upright position, which is really, really great for labor to help things progress. If you do that, sometimes after maybe an hour or two of doing that, you might start to feel like, I can't feel the epidural as much, the pain is coming back, and that's because the gravity is pushing the medicine down. At that point, they will tell you need to go back on your back. And even when you lay on your back, at that point they'll tell you need to go back to the bed. And even when you're on the bed, you usually have to be on your back. And if you've ever been in labor, you know that for a lot of moms, being on their back is the last position they want to be in. It's not comfortable for them, but you have to be that way, because even if you stay on your side, then the epidural is going to drop to one side, and then the other side doesn't get the medication. So these are some of the things that you have to consider, and this is why it's a very, very good idea, even if you must take the epidural, to try to push it for as long as you can, so that you have a chance to move around, let labor progress to a certain point, let your body open up before you take the epidural, where you now have to sort of be tied to the bed. Again, depending on your body, depending on how well they put it in, you might feel completely no pain, or you might feel a little bit of pain. And another thing is that you also need to be very careful, because even if you have the light dose where you can still walk, you cannot trust your legs completely. You still have to be very careful, hold on to something or hold on to someone, because your legs could really buckle at any time. So these are some of the things to consider. So this is another way that you become dependent on others, because you need somebody to hold you if you need to move. If you need to change position, you might need assistance into getting into different positions. So even if you plan to have the epidural, it's still good to make sure that you have a very good, strong support system. That could be your partner, that could be a doula, but just someone who can be an extra set of hands to help you change positions, to help you move around, because you cannot rely on the hospital staff to be available to do that. They have so many other things that they might be working on. So what are some of the potential side effects that come with getting the epidural? First of all, you could experience changes in your blood pressure. That's why they typically would have the IV fluids hooked up to you so that they can sort of manage your blood pressure. Some women also experience headaches when they get the epidural. So these are sort of some of the side effects. It can get even more drastic. I know that I've seen some women in my comments telling me about how they have like continuous back pain. They've always had back pain ever since they got the epidural, or somebody had temporary nerve damage. I remember someone in my comments was telling me about that. Those are some of the more extreme side effects. But even something like maybe soreness at the site where the epidural was administered, that's something that you could experience. I think the headache though seems to be a very common one, where you just feel like very, very excruciating headache. And then the nerve damages, like temporary or permanent nerve damage, seems to be not as common, even though it's a possibility. So while we're on this topic, sorry, I just have my notes here so I don't forget anything. So while we're on this topic, I want to talk about some of the pros and cons of the epidural. Like I was saying with the side effects, those are some of the cons of it. You know, the headaches, your blood pressure maybe dropping, baby's heart rates too could also drop. Some babies absolutely do not like when the epidural is inside of you, and so when they get the epidural, when the mom gets the epidural, you start to notice a tank in the baby's heart rate, which is one of the ways that you see one intervention leading to another intervention, where you get the epidural and so your baby's heart rate is like very disturbing, and then they have to do an emergency C-section. But another way that the epidural can lead to other interventions that you might not have wanted is, you know, when you get the epidural, sometimes it sort of just overall slows down labor. You know, your contractions stop, or they're not as consistent, or they're not as strong, and so then they have to now administer the pitocin to you, which is basically it's an artificial way of triggering those contractions. And so, you know, you get the epidural, the contractions are slowing down, and so now you have to get pitocin, and pitocin can also still lead to your baby struggling, because the contractions from pitocin can be very, very strong, and so it affects your baby in a way that baby's not coping well, and then you might end up with an emergency C-section. Or there's been some moms who, after getting the pitocin, the contractions were so strong that it led to uterine rupturing. Now, if you're interested in knowing about pitocin and how everything that goes into it, I have a video specifically on that. You should absolutely check that video out if you're having a baby, because inductions and augmentations, which are usually done with pitocin, inductions is when they start labor, when they artificially start labor. Augmentation is when they artificially speed up labor that has already started. These two interventions usually involve pitocin, and they are very common. Very, very, very common. So if you're someone who is pregnant and having a baby, you absolutely should watch this video on pitocin before you go into labor, so that you know what to expect, you know how to ask the right question, and you just have you're more educated, and then you can make an educated choice if it gets offered to you, which it most likely will be. So one of the cons of getting the epidural, like I was saying, is that your contractions could slow down. But even if that doesn't happen and you get to the stage where you can push, sometimes because you're so numb, you're not really able to feel what is going on, and so you're not able to push effectively. You need to be able to feel to push, and so once you've numbed those feelings, you're not able to push effectively, and so it might make your pushing stage last so long, where your doctor would have to use forceps or vacuums to pull your baby out because you're not pushing effectively. And typically when they have to use forceps or vacuum, they need to do an episiotomy on you. So getting the epidural will make you more likely to need forceps or vacuums. It will make you more likely to need an episiotomy. if you're pushing for so long and your baby's heart rate starts to drop, it could also lead to them needing to do an emergency C-section, just because you're not able to feel and push effectively. And again, remember I was telling you that you're hooked up to so many wires, because they need to keep a close eye on you, that it really limits your movement. And movement is so important to making sure that your labor progresses smoothly and faster. But now I want to talk about some of the cons, which are some of the reasons why some women still decide that the epidural is the right choice for them. And it's really that aspect of it taking away the pain, especially if you're someone who's gone through labor for a very long time, or you've been pushing for a long time and you're so tired and you really just need a break. An epidural is something that could come in and where you can take a light dose so that you can get some rest. And sometimes even if you're tired, sometimes you might be tired, but you still are willing to go, but your uterus is tired. Like, your body is literally tired, and so contractions will slow down. So getting an epidural might be the thing to help you rest, and then the contractions can pick up again. But that's really a gamble, because epidurals are known to slow down contractions, but in some cases they can help you rest and then the contractions will pick up again. But it's really a gamble that you have to decide if it's a risk you're willing to take, where it slows things down even more, and then you might need to get Pitocin to speed things back up again. And then I would say the final pro of it is that sometimes, especially when the labor is much worse than the mom anticipated, or even though she knew it was going to be bad, but she's just really struggling, and she's just like in distress, in a state of distress where she's not present. I don't know, is delirious the right word? I think so, maybe not, but she's delirious and she's not really just able to be in the moment. An epidural sometimes can help her to just have a better experience of what is going on in labor. Instead of being frantic in so much pain that she cannot concentrate, suffering, an epidural could take that away. But this could also be taken away by having the right team, having the right preparation, knowing what to expect, knowing ways that you can manage the pain. There's so many other ways that could also help you not get to this stage, but it just takes a lot of preparation. But if you're in a situation where you found yourself there, you're in labor and things are just not going well, for some women, they decide to have the epidural just so that they can be more present and just not be in that state of distress. But now I want to talk about how you can get the best out of your epidural. The first thing first is to make sure that you delay it for as long as possible. There's some people who are like, as I'm getting to the hospital, get me the epidural. It's your choice, absolutely, but I think it's best to delay it for as long as you can, to give you a chance to move around and to just work with your body to help things progress faster. The more established labor is, the less likely it is that the epidural will slow down your contractions. Just letting things establish a bit more before you get the epidural can really make a difference. Also, another way to get the best out of it again is to make sure that you have a team that is ready to support you into different positions, so you can still try to manage yourself into different positions that would help your labor to progress and help baby to move. Another great thing to do is that you can ask for a lower dose that doesn't quite take all of the pain but really reduces it. And the reason why this is a good idea is because then you have more feelings in your leg, and so you can move or you can stand, but more importantly, when it's time to push, you can feel, and so you would reduce your likelihood of needing episiotomy or forceps because you can feel what you're pushing. Finally, another point on how to get the best out of it is, even if you've decided that you want the epidural, you can also ask your team not to suggest or ask you, do you want it now, until you say, okay guys, I think I want the epidural right now. The reason for this is that you will probably be able to last longer this way than if every 30 seconds somebody's like, so do you want the epidural now? Do you want the epidural now? Just tell everybody, I'm open to the epidural. I'll ask for it when I'm ready. And that will usually allow you to go longer before you take it. So what's the postpartum recovery like if you had the epidural? That really depends on your body and if you have those side effects that we were talking about. If you're having, that excruciating headache we talked about, or some of the temporary nerve damage, or soreness, then your recovery will take longer. Or if you got the epidural and so you needed to get an episiotomy and they needed to use the vacuums and forceps on you, your recovery will probably take longer than someone who didn't have the epidural and didn't need to have all those things done. But it really depends on like how your body reacts to it and what other procedures needed to be done as a result of the epidural. And then for the part of the baby, typically if you are able to go through those contractions and push baby out fairly quickly, and you know, baby wasn't struggling or anything like that, then baby would typically be fine. But if your baby's heart rate dropped and they had to, you know, give you the episiotomy and use those forceps to pull baby out, you might notice that your baby is crying a lot because their head is sore from just using the vacuum or the forceps. The pediatricians will have to do some checks on your baby if they use the forceps, just to make sure that there isn't any internal bleeding or anything like that. So these are just some of the things that you should keep in mind for how things are going, and especially when you're making those decisions. But one thing I want to say is that absolutely, because I get comments anytime I talk about, you know, unmedicated births or epidurals, I always get those people who are like, yeah, don't shame moms, you know, you're a hero however you give birth. Absolutely, I'm not here to shame you. That's not what this channel is about. This channel is about providing you with information so that you can make the best decision for yourself. So that's what this video is supposed to be. If you're someone who's on the fence about, do I want the epidural or not? These are some of the things you need to know before you make your decision. Absolutely, whatever decision you make, you know, just have the right information and do what you feel is best for your family. Also, try to be aware of how things can progress when you get the epidural, so you're not taken by surprise. Like sometimes, you know, I see women who talk about, oh, I got the epidural and then this had to happen and then this had to happen. You need to understand how these things can progress so that you know that if I'm signing up to get the epidural, there's a very good chance that I will need to get Pitocin. So if you're strongly against getting Pitocin, you should really think about whether or not you should get the epidural. Do you understand? So just think about it so that you don't start a process that you're not ready for, how it could progress. And also so that while you're there and while they're presenting you with your options, you sort of know how things could go with each option. And then again, you make the best decision for you and your family. I hope you found this helpful. If you have any questions, feel free to leave them in the comments, and I'll see you in my next video. Bye. Jeez.